Right Honorable Bonzena John Kizito, thank you so much for being
here. The
here.
Free to Shine Triple Elimination Campaign for HIV, AIDS, syphilis and hepatitis is an initiative of Nigeria's First Lady, Senator Oluremi Tinubu, in conjunction with the Organization of African First Ladies for Development. The initiative aims to promote healthier mothers by 95%, reduce new HIV infection among women of reproductive age, eliminate mother-to-child transmission of HIV, and provide with HIV by 95% by 2030.
The launch of the Free to Shine campaign aimed at the comprehensive elimination of HIV/AIDS, syphilis and hepatitis among women of reproductive age, as well as the prevention of mother-to-child transmission and the treatment of affected children in Taraba State is commendably timely.
While giving an overview of the initiative virtually, the Executive Secretary, Organization of African First Ladies for Development, and the Coordinator, National AIDS and STDs Control Program, gave an analysis on the status of the fight against the ailment.
The rate of HIV infection among children in Africa is beyond alarming. From the more than 2 million children infected worldwide, more than 1.4 million are found in Africa. We cannot accept this reality, not when we have the tools, the knowledge, and the collective will to change it.
Other speakers, including the Director General, National Agency for the Control of AIDS, WHO Country Representative, and UNAID's Country Director, call for galvanized support to win the war against HIV, AIDS, syphilis, and hepatitis to ensure a healthier nation. The Coordinating Minister of Health and Social Welfare says the federal government has approved 200 billion naira for the purchase of HIV, AIDS, tuberculosis, malaria test kits, and other drugs, and calls on state governments to complement federal government's efforts in healthcare delivery.
If His Excellency has put 200 billion naira already and has asked for it to be ring-fenced, many of those, almost all the patients are in various states. How can state governments also come in so that we join hands to ensure that we take care of our people?
Governor Abu Kefas, on his part, says the campaign is commendable, just as he says that all interventions from the federal government to the states are transparently utilized.
We therefore respectfully request that more resources be extended to Taraba, as we are prepared, committed, and accountable in translating every intervention into real progress.
The First Lady, Senator Oluremi Tinubu, in her remarks, says Nigeria, with the highest burden of HIV/AIDS in sub-Saharan Africa, needs collective and urgent action to curb further spread.
This particular burden we are talking about is very severe among children, youth, women, and marginalized groups. Because when you hear mother-to-child transmission, the men too are affected. When you hear our survivor's story today, you will see their husbands are passed. But I don't know why, but I believe that our men are also in denial.
The Free to Shine Triple Elimination Campaign of HIV, AIDS, syphilis and hepatitis targets 95% of Nigerians to know their status, get adequate medication and treated before 2030.